Welcome to ADAA's educational presentation on a recent research study that found CBT and DBT protected patients from pandemic-related anxiety. My name is Jolie Busby, and I'm the Education and Training Manager here at ADAA. I'm very pleased to introduce our speaker. Dr. David Rosmarin is the author of Thriving with Anxiety: 9 Tools to Make Your Anxiety Work for You. He is an associate professor at Harvard Medical School, a program director at McLean Hospital, and founder of the Center for Anxiety, which provides services to over 1,000 patients a year in multiple states. Dr. Rosmarin is an international expert on spirituality and mental health, whose work has been featured in Scientific American, the Boston Globe, the Wall Street Journal, the New York Times, and Good Morning America. He can be reached via the Center for Anxiety at www.centerforanxiety.org. Well, welcome. Thank you so much for being with us today.
My great pleasure. Always awesome to be here with ADAA.
And we are appreciative. So we wanted to talk to you a little bit about your research because in March of this year, the Harvard Gazette published an article about your study of patients being treated for anxiety and how they managed through the COVID-19 pandemic.
Yeah, so you're taking me back a couple of years to a period of, I would even say, my own anxiety, because I had 500 patients at Center for Anxiety at that time, and we had to shift everyone to telehealth in 2 weeks. So the patients had pre-existing anxiety. And sure, we have our tools, we have our cognitive and our dialectical behavior therapy, and I was confident in those, but it was pretty extenuating circumstances, and I was pretty nervous myself about how the patients are going to fare under the care of my staff. To my surprise, throughout the entire pandemic, we did not detect a significant increase or a bump in anxiety among people who had been in treatment prior to March 2020. And I spoke to my other colleagues about this, and they were observing fairly similar things in different areas around the globe. So last year, finally digging ourselves out of the pandemic and all the work that had to be done, especially on the mental health front, I linked up with my longtime colleague, Dr. Stephen Piratinsky, and I said, you know what, we have some data on this. Maybe we can actually unearth and look at whether this anecdotal experience of foreboding, how are our patients going to do, and then actually not seeing tremendous fallout on the patients who were previously in treatment, did that actually suss out in the data? If you don't do research, you don't really know. I had my own experience, but I didn't really, know that for a fact. So we looked at 764 patients, and we looked at them basically in terms of time. They were people who came before the pandemic, actually people who came in 2019. Then there are people who came between January 1st and then March 2020, people who came in the early pandemic, and then people who came later. And what we found, really incredibly, is that the patients who had been involved in cognitive and dialectical behavior therapy before March 2020 did not have an increase in anxiety at any point during the pandemic, which is remarkable because in the general population, there were increases of 25, 30, 40%. You can see my AI is so excited about these results. There were incredible increases in emotional distress, but we did not see that in our patient populations. And what we think is going on is when patients have the right skills and tools to be able to manage their emotions, then it actually inoculates them against future distress, even in extreme circumstances. I mean, the world was reeling from uncertainty. Nobody knew what was happening with the economy, and it was a tumult. But part and parcel of cognitive and dialectical behavior therapy, and maybe the core of these treatments, is to not be afraid of anxiety itself. Right? In our society, we think of anxiety as a disease, and we immediately react to it when we start to feel that way. Something's wrong with me. I can't handle this. Well, when we have that reaction, that increases our adrenaline. And that creates a cascade of symptoms, which takes our anxiety from a 2 to a 10, right? That's our fight or flight response. We're actually responding to the anxiety itself. And in cognitive and dialectical behavior therapy, one of the first pieces of information is that anxiety is normal. Let me ask you a question. Have you ever met somebody who has not had anxiety before?
Never.
Never. It doesn't
Never.
occur.
Hmm.
All human beings, right? CEOs, pop stars, right? Myself, definitely. Um, Everybody has anxiety. And that message in of itself, the fact that this is a normal human emotion, is so important, especially going into a challenging time, going into but so much so that I think it actually has public health implications. And we really need to start looking and thinking about anxiety as an aspect of humanity as opposed to something that we need to get rid of. We can thrive, I believe, we can thrive with high levels of anxiety. It can be a catalyst to growth. It can help us to connect with others. It can help us to achieve what we want to in this world. And maybe most of all, with regards to the study, it can inoculate us. When we have the right skills and tools, it can inoculate us and make us more resilient to face really out of the ordinary levels of distress. So to me, that's what this study is about.
That's a very interesting way of putting it, is to inoculate. We think about the vaccines and things that were coming up to inoculate us against COVID-19. We didn't really address the emotional inoculation of that. I would have volunteered for that. Well,
Yeah.
very good. Thank you so much. I appreciate your time on this. If there's anything else you'd like to add before we close.
I guess I'll just add this. Hopefully no more pandemics and no more craziness in the world. But at the same time, I think given everything that's going on, you kind of have to expect that things are going to come out of the ordinary and out of the blue. Um, I would recommend that even if people don't have significant levels of anxiety, it's a good idea to get some CBT and DBT tools under your belt so you know how to respond if and when these emotions pop up. And if we take that approach, they say an ounce of a pound of prevention is what is it? An ounce of prevention is worth more than a
At the
pound of cure.
pound cure, yes, that's
Yeah.
exactly right.
I think when it comes to CBT and DBT, it doesn't take much to prevent, and it does take a lot to treat once people are already down the pike. So maybe I'll conclude with that.
That's a wonderful thing to share. Hopefully everyone is encouraged, and we'll have some resources added to the end of this video if people are looking for that, and also your website that we've added to that. So thank you very much. We appreciate it. Hopefully we'll have you on again soon, maybe with some new information to share.
Anytime.
Thank you.
Thank you.
The Anxiety and Depression Association of America works to prevent, treat, and cure anxiety disorders and depression through the alignment of science, treatment, and education. We invite you to explore our website at adaa.org, where you can find resources such as our Find Your Therapist directory, free evidence-based webinars, blogs, and videos, ADAA's free online peer-to-peer communities, and self-help books and publications. Also, please consider subscribing to our free monthly e-newsletter, Triumph. On behalf of ADAA and our presenter, Dr. David Rosmarin, we thank you for joining us today. We'll see you next time.